Great. Thank you all so much for joining us. And let me introduce myself and welcome everyone. And we'll keep allowing other folks in from the waiting room as we begin the session. My name is Andy Perrin. I'm professor of sociology, and I'm the director of the Institute for the Arts and Humanities here at UNC Chapel Hill. And I'm thrilled to be able to welcome you today to a co-sponsored Zoom conversation that we are co-sponsoring at the Institute along with the Center for Faculty Excellence. We have been doing at the Institute a series of Zoom talks, and you can find other recordings of those Zoom talks on the IAH website, where this one will be posted as well. And our goal is to provide opportunities for conversation among Carolina faculty on issues both during and related to the COVID-19 pandemic. Provide those opportunities for conversation, expertise, and sharing. Erin and I thought it would be really helpful to provide some opportunity for conversation with some faculty experts as we look at the process of the fall semester in such incredibly uncertain times. And so we're thrilled to be able to provide this opportunity for that. Erin is going to introduce herself and the conversation in a few moments. Let me just tell you that our hope is, our preference is for these IAH Zoom talks that we can simulate as much as possible a true conversation. And so we ask, if you're able and willing, that you leave your video camera on so that others can see you. Obviously, if you're uncomfortable or unable to do that, please don't do so. And please leave your microphone muted unless and until you are asking a question or participating in the conversation. Again, this conversation will be recorded, and we will do some light editing and post it to the IAH website once that's complete. Let me then turn it over then with great thanks to the IAH staff, particularly Ebony Johnson, our events coordinator, who has done a tremendous amount of work in the background getting this process going. Let me turn it over then to Erin Malloy, who will move to the introduction.
Great, thank you very much, Andy. And can I get a thumbs up from you, Andy, if you can hear me okay? Perfect, thank you. So for everyone, my name is Dr. Erin Malloy. I am a faculty member, a professor in the Department of Psychiatry and School of Medicine. And I also serve as the director for the Center for Faculty Excellence. And it's really exciting to be able to emerge into some more partnerships with the Institute for the Arts and Humanities. And Andy and I go back a few years now, and we are both excited about having faculty experts share some reflections and wisdom and just some conversation around these topics today. So I do want to thank, on the Center for Faculty Excellence end of things, Tricia Bienvenu, who is our program coordinator, as well as Monty Hampton, our communications manager, for helping to put this event together from the CFE side of things. I'll launch right into introducing our panelists today. The first is David Weber. David Weber is a physician and has a master's of public health as well. Is a professor of medicine in the Division of Infectious Diseases, also professor of pediatrics at the UNC a professor of epidemiology in the Gilling School of Public Health, and the medical director of UNC Hospital's Departments of Hospital Epidemiology and Infection Prevention. Also serves as Associate Chief Medical Officer for UNC Healthcare. And Dr. Weber is someone whose wisdom has been sought after across campus and outside of campus nationally as well, as an expert in managing and thinking through issues regarding the coronavirus. Secondly, we have Dr. Viji Sathy, who is a teaching professor of psychology and neuroscience here at UNC as well. And while a lot of her work is related to teaching statistical principles in psychological research and research methods, what she's known for also very much so is inclusive teaching and teaching practices that really do engage students of many different backgrounds. She's nationally known, has been published in the Chronicle, sought after across the nation in terms of sharing wisdom and best practices around teaching and learning and being inclusive. So thank you for joining us as well, Dr. Sathy. And then finally, we have Dr. Sarah Stroud, who is a professor of philosophy here on campus, as well as the director for the Parr Center of Ethics. And she actually has published a number of papers on topics such as partiality, moral demandingness and overridingness, lying in testimony, practical irrationality, and the moral implications and significance of personal relationships. So we are very pleased to have all three of these experts here to begin our conversation today. So Andy, I think I'll turn it back over to you to begin the moderation.
Absolutely, thank you. So we are going to begin with Dr. David Weber, as he may have to leave the session early, and so we want to make sure we gain his insights first. So I've asked him to give us a few minutes worth of thoughts and insights relevant particularly to the opening of the campus or the process of approaching the fall semester. We'll then move to Dr. Sathy and then on to Dr. Stroud, and we'll have plenty of time for questions, comments, conversation after that as well. So Dr. Weber, please.
Thank you. Just by beginning my presentation, to remind you at the present time, there have been more than 10 million cases worldwide of COVID, more than 500,000 deaths here in the US, more than 2.6 million cases, more than 126,000 deaths. To put that in perspective, just imagine a 777 Boeing plane crashing every 8 hours. This has been going on now for more than 3 months in the United States, so very important. And we are undercounting deaths by probably 20 or 30% in the US there. In terms of North Carolina, more than 50,000 cases, more than 1,300,000 deaths. As of today, 843 people hospitalized. The state has performed roughly 886,000 tests with a 9% positivity rate. If you look at the numbers worldwide, we're not out of our first wave in the United States. In fact, we have an increased number of cases, our highest case totals, although the death rate has fallen. The other hotspots in the rest of the world are in particular Brazil, which is having a massive outbreak at the moment, followed by India there. In terms of North Carolina, as I said, our numbers of cases. What's different about the epidemiology now than it was 2 months ago is 2 months ago, most of the cases were older individuals, particularly from nursing homes, in congregate settings like cruise ships, some factories, prisons. Right now, the biggest group, both in the United States and North Carolina and here at the medical center, are people 18 to 40, which is presumably reflects less physical distancing, opening of the areas of states, and more congregate not wearing masks. They're nationwide, about 5% of tests are positive. North Carolina, that's closer to 8% of tests right now. And so the hotspots in the United States really are California, Nevada, Arizona, and then a swath going from Texas across the southeastern part of the US to North Carolina, but particularly Louisiana, Mississippi, Florida, and South Carolina. Now I have a number of questions that I know that you want to ask, so let me start answering some of the questions before you ask them, I hope. One, do medical masks work? The answer is absolutely yes. We know wearing a mask is 80 to 90% at least effective in preventing you from acquiring SARS, for instance, there. So wearing a mask is tremendously effective. Physical distancing is tremendously effective. Again, 80 to 90% reduction just by 1 meter or 3 feet. And the further you are away, the better the protection. So 6 feet is better than 3 feet. We know this disease obviously is droplet and direct contact. Probably indirect, meaning if I'm infected, I rub my nose, I touch a doorknob. Can someone touch that and catch it by rubbing their nose? Probably. So hand hygiene and surface disinfection important. I will also say there are now several excellent studies with taking people with actual infection, not COVID, but with endemic coronaviruses or influenza, demonstrating that if the infected person wears the mask, that's highly protective, probably better than the non-infected person wearing a mask in preventing aerosolization of infectious particles. So ideally, everybody would wear a mask because if the person is infected and the person is uninfected, that adds, it's synergistic in preventing transmission. there. We know that people certainly can be pre-symptomatic and transmit in the 2 days, 2-3 days before you develop symptoms. The highest viral load is on the day you develop symptoms. We know somewhere between 20 and 80% of people are totally asymptomatic. We believe they're infectious, but that's been harder to nail down. So based on what I've told you, the way to safely open this campus is everybody outside of their dorm room or their home should be wearing a mask in any public setting, regardless of whether you have symptoms or not, certainly. And if you're symptomatic, by the way, you should not come to work or not go to school. You ought to call campus health or occupational health and be seen and be tested. So wearing masks, physical distancing, a minimum of 3 feet, preferably 6 feet, with appropriate disinfection of shared equipment and hand hygiene is the way to protect ourselves. What about cloth masks? Well, our colleagues in the EPA building here on campus have been testing those. The problem is there are no standards for them. How well a mask works depends on how tight it fits around the face and the filtering efficiency through that. So some of the cloth masks worked very poorly, much inferior to medical masks, while others were about as good as a medical mask. So that information has been presented to senior university leadership. I suspect those better performing masks will be purchased by the university and either be made available free or at a minimal cost through campus stores and the bookstore and things like that. What about public restrooms? Well, the biggest risk in the restroom, first of all, is people take their masks off. So obviously you need to wear that. There's no evidence that this virus is live virus in stool or aerosolization of stool gives you a risk. So then it's really touching things that other people would touch and being in close proximity to people. So hand hygiene before you go in. And then you want to do, the last thing is hand washing, take a paper towel, turn off the water spigot so you don't recontaminate your hands, and then either use that, then throw that away, get a clean paper towel, open the door and leave, or use a waterless wash. This is an envelope virus, and the alcohol waterless washes will kill this virus within 10 seconds. Disinfecting packages and groceries, hard to know if there's any risk there, not been described. We know the virus does survive on things like formica and steel for hours to a few days, but does not live well on paper products for less than 3 hours. There's no data that it's food or water transmitted, but that said and done, if you're drinking a cup of water or soda and you drink it and pass it to someone else, could be in saliva, and it could certainly be in the throat. The nose is a better spot for culturing live virus, but it can be found in the pharynx and in saliva there. Mortality has dropped even though cases have gone up. That's for 2 reasons. One, we're better at treating patients with non-invasive means like ventilating them when they're on their bellies, better use of oxygen. We do have 2 drugs that we're using we believe work, which are remdesivir and dexamethasone, and we're also giving people convalescent plasma with antibodies, but that has not been yet shown the efficacy. And so that's one reason we're seeing lower mortality. We're seeing younger patients in the hospital. That's another reason, and mortality is very age-related. And finally, deaths are going to lag 2 to 3 weeks behind cases, and cases will lag 2 to 3 weeks behind opening things up in society. So I actually think the death rate will rise in the next few weeks. While risks are lower to young people than older people, we have 5 children here in the hospital now, under 18. We have several young adults. The odds are better, but there's still a reasonable mortality in children and adults. So this is not a disease anyone wants to get. And keep in mind, I'm only talking about mortality. Many of the people who become infected, even those who do not come into the hospital, have long-lasting things like fatigue, loss of taste and smell that can be permanent, severe headaches that can last for weeks or months. So even those who are not sick enough to get admitted may have substantial morbidity from this. In terms of materials, masks are not in a short supply. Neither are soap and water, of course, which works well too. We can do 1,000 COVID tests a day at the hospital. In the next few weeks, we'll ramp it up to 2,000 and we'll continue to expand. But even with that, we don't have the capacity, for instance, to test every single person on campus, symptomatic or not symptomatic, on a periodic basis. But the hospital in the state is continuing to rapidly expand its testing capability. So my final conclusions are, right now, if you're sick, go get tested, don't come into work or come into the university, and it's a rapidly expanding list of symptoms. So fever over 100, feeling feverish, chills, cough, shortness of breath, sore throat, runny nose, fatigue, muscle aches, all of which headaches not explained by other symptoms. Call university occupational health, your private physician, or campus health. Practice physical distancing, wear your masks, particularly indoors, good hand hygiene, and a proper surface disinfection. So that's how to be safe. And I will tell you that because of the increased community transmission, the biggest risk to our faculty is at bring home. We have 2 of our faculty at the medical center out because their children brought it back to them. Not that they are sick, but they're furloughed because of potential exposures. And we're not seeing and haven't seen transmission from our patients, even if they have COVID, because we use proper precautions with all our healthcare personnel. But we have seen occasional exposure where people are going either off campus or on campus, eating and drinking together, and being exposed. Thank you. And when we're done, I'm happy to answer questions.
Great. Dr. Weber, I have 2 really quick ones for you, just for clarification, if that's all right, and then we'll move on. One comes from a participant who asks whether by a medical mask you mean a fitted N95 mask or a surgical mask.
That is an excellent question. There are multiple studies and 2 meta-analyses, at least, that look at this issue. So a surgical, any mask, that is a medical mask or an N95, is very protective against infection. Interestingly enough, when you compare a medical mask versus an N95, there is no statistical difference in those. Now, you have a slight trend to more efficacy with the N95, and we do wear that for aerosol generating procedures, but you can't show a statistical difference when exposed to SARS or other diseases for those 2 respiratory protection devices.
Great, thank you. And then just to one other clarification, if a professor were in a classroom and all the students are wearing masks at 3 feet and no one has, none of the students in the class or the professor have symptoms, in your view, is that adequate to prevent spread? You said it was effective. I'm interested in whether you think that's an adequate level of protection.
The answer is no. I think if you're in a confined airspace, even though 6 feet away, tremendously drops the risk. My view and the university policy is that everyone will stay masked while they're in a congregate setting like that. Again, it's being safe, and all the protective mechanisms, distancing, everyone wearing masks, is synergistic with each other. So the recommendation is, while in those settings, everyone should be masked, and ideally at least 6 feet apart.
And if they are masked and 6 feet apart, you think that's adequate to prevent transmission?
The answer is yes.
Great, wonderful. Thank you so much. Let's move on then to our next speaker, Dr. Viji Sathy, teaching professor of psychology and neuroscience.
Thank you, Andy, and thank you for those really helpful remarks. I was taking notes as you were going along. I want to start by thanking all of you for being here today. I know that this is summertime, and summertime means something different for different members of the community. So I appreciate that you're here and wanting to be a part of this conversation. I'll keep my comments relatively brief because I think we could talk for days about teaching in this new era we're in. But I thought I would just focus my comments on some of the new themes that I see emerging in the discussions related to teaching as we have transitioned from this emergency remote instruction into thinking about what the plan is for the fall. And along those lines of our care, when we think about our physical care, I want to be thinking about our emotional and well-being care as instructors, and thinking about ways in which we can foster community amongst ourselves, to learn from one another. This is new territory for all of us, and so I think it's really a good time to be thinking about how do we shore up our network and be able to communicate with one another and support each other. I know that this quote has been batted about several times about us being in the same storm, but in different boats. And I think that that is not only true in terms of equity and how and who is disproportionately impacted by this virus, but by what we're dealing with in society. And it would be a mistake to start the semester without addressing these issues. In fact, I recently spoke to a reporter for the Chronicle of Higher Ed about how do we start these conversations at the start of the semester, what kinds of things are important to convey to our students. A lot has changed in a short amount of time, and we're not in a position to ignore, and we really must speak up. And so I want to encourage us to think about how do we frame some of these discussions when we get back to the classroom. And think about how do we maximize, if we are to meet in the beginning of the semester, how do we maximize the time in which we are meeting, what kinds of things should be prioritized in the chance that we have to then switch to remote at some point, what kinds of things would be helpful to be thinking about. And then I wanted to just point out a few things related to just no matter what modality of instruction we're going to be thinking about for the fall, some universal things to be considering. One is what I would like for all of us to be thinking about what makes teaching and learning, that interaction, valuable. I think if we don't think about that as our starting point, we're doomed in designing our courses. So this reminds me of an exercise that I sometimes go and speak to future faculty, so graduate students who are training to be faculty, and I have them write on an index card on one side, what's something that your students struggle with in your discipline, in your area that you're teaching. And then on the back of the card, what is it that you as a person can add to a classroom experience, to a learning experience? And then we share these and we say that, ultimately what we'd like to do is to align these two things. We'd like to see how you as an instructor can bring value to the classroom, but also to troubleshoot some of those areas in which our students have trouble. And so I think it's the same process as we move forward in the fall. What is our value add in the classroom? If it's in the classroom, if it's online, how are we contributing rather than just handing over a book or a set of videos? What is it that we can bring to our students? And I think one thing we can bring, and it's important to bring, is compassion. I think this is a chance for us to model what it looks like to be resilient, to be compassionate, to be flexible, to do all of the things that I think good educators aspire to do, but now we have a chance to show it in the way we design our courses. We have a chance to show it in the way we respond to how they might miss assignments, how they might miss classes. I think these are all things we've all wanted to do and have had struggles in implementing in previous iterations of our courses. And now we're going to be forced to really think about how to bake this into our course design in an intentional way, because it's going to happen. Students are going to miss our classes, and we're still going to want them to have information and access to some of the work that we do. So thinking about this as we build our courses is really important. And then I think in general, what I see a lot of people go to quickly when they're thinking about changes to their instruction is the technology. And that is not the right place to start. I know that it seems easy to think about Zoom first, but Zoom is not a pedagogy. It's a platform with which we can communicate with one another. What you should be thinking about is, how do I enhance this interaction that I have with students, with the material? How do we work together? And then go to the tools to think about what might be beneficial to use. I have been reading a lot about resilient pedagogy, and of course I know a good bit about inclusive pedagogy and universal design for learning, but I'm hearing more and more about this resilient pedagogy, and thinking about including aspects in our course design that allows for a pivot to whatever format that we might have. So for example, if we have discussion questions we'd like to engage students in, that we have those discussion questions visible if we're in the classroom, but also that they might be easily ported into a discussion board for people to engage in, or that they might be available in a synchronous format, maybe through the chat window. So really thinking through what is it that you want students to do, and how might that work in different platforms that we might be in. If we start that way, then it's easy to change at any point as we move through the semester. So working backwards, thinking about what your goals for your students are, what they might be able to accomplish at the end of the semester, and then allowing for lots of practice during the course of the semester through various mediums is really helpful. And then specific to face-to-face or online instruction, I think face-to-face is going to be a little bit of a challenge for all of us because it's not really face-to-face. It's mask to mask with distance. And so those simple tools that we have, and I'll give you some examples in my own classroom of walking up to a student and looking over their shoulder at their work or asking if they need help. That's not available to me in the same way anymore, right? Or saying to a student, turn to your neighbor and discuss this. This neighbor is now 6 feet apart with a mask on. So some of the things that we use frequently in the classroom, some of those tools in our toolkit are going to need to be adapted in some way. And I do think it's possible, but it just we need some creative thinking about how to make that work in a mask-to-mask classroom. And I think the key part for this instruction where we are in a brick and mortar building together is what's the benefit of gathering? It was easy to think about the benefit of gathering when there weren't these, distance requirements or mask requirements. Of course, when we add those in, we might have a different answer for what the purpose of gathering is. So I'd encourage you to think about that and to think flexibly. Is it necessary to meet for every single class or maybe even portions of class? It may not need to be that you are logging time face-to-face in that way, that you could be thinking about your lecture delivery not occurring behind a mask, but rather through a video where you're able to really convey clearly what you mean, and students can play back material or pause. So there are certain mediums that are helpful in this online environment. And we've heard from some students that is, those are ways in which we can be more inclusive in our approaches. And then as we think about online, I think this is the challenge for most of us who have very little experience with online teaching. How do we build the rapport and the community that we're used to in our classrooms, where we could see a student regularly in class, where we could have some chatter before class or after class about their lives? There are ways in which we can foster that in an online environment, and there are certainly lots of tools and writings about how to do this. So I encourage people who are teaching online courses to learn about those tools. But in general, I'd say this is going to be the focus for online, is how to build community, because not only are you probably a little bit unsure about how to do it, students are also unsure about how to do it. And this comes back to the inclusive aspect. We can't just throw things at students and expect that they're going to know how to use them. And, a perfect example is a car. My kids spend a lot of time in a car, but that doesn't make them a good driver yet. And so just because we have tools and we know that they know how to turn on Zoom doesn't necessarily mean that they'll use it effectively. So thinking about how we build in structure and transparency in the tools that we introduce, as well as how we want to do some of the work that we might in a normal situation, pre-COVID, be able to supervise. So if a group is not working well, for instance, I might be able to come in and help troubleshoot. In this instance, we're going to want to bake in mechanisms for that group to learn how to communicate with one another, to find out what best practices are for working for a group. And what I find optimistic about this situation, if one could be optimistic, is that I think whatever we design in this next semester, much of it will stick and be useful to you in the future. So I hope you'll consider this an investment in your courses and in the way you think about the materials that are available to your students. These are things that you will probably come back to and refine in future semesters. I'm reading a really lovely book right now, and I'll hold it up. It's called Radical Hope. It's by Kevin Gannon. And I happen to know Kevin, and I know the process with which he wrote this book and where he landed. And I think he could never have anticipated how timely this book would be when it came out this spring. But I would like to read this quote from the book. "Teaching is a radical act of hope. It's an assertion of faith in a better future in an increasingly uncertain and fraught present. It is a commitment to the future, even if we can't clearly discern its shape. It's a continuing pedagogical practice rather than a set of static characteristics. Simply put, we teach because we believe it matters." And I think this is a really lovely way of reminding ourselves of the privilege of teaching, and that we get to continue to do this when it seems like the entire world is coming to a grinding halt around this pandemic. So I look forward to your questions and conversation about how we continue this practice.
Dr. Sathy, thank you so much for those comments. And let me turn then to our third speaker before we open for conversation, Dr. Sarah Stroud, Professor of Philosophy and the Director of the Parr Center for Ethics.
Thank you, Andy, and thanks everyone for coming. I'm the director of the Parr Center for Ethics, Carolina's focal point for informed, thoughtful inquiry into and discussion of ethical issues. Our overall mission is to nourish and foster ethical reflection on campus and beyond. So I'm delighted to bring that perspective to the discussion, even though compared to the other two speakers, I don't have a distinctive subject matter expertise that I can convey wisdom from. Ethics and ethical reflection is not really a subject matter in the same way that epidemiology and the study of teaching and learning is. It's a mode of thought. And so really I'm just here to maybe suggest some of the things that that distinctive mode of thought might include as we all get ready to go back to our roles in the fall as educators. And maybe just give a hint of what it would mean to reflect ethically about those roles and responsibilities. So ethical reflection as a mode of thought centrally involves things like thinking when you're making choices or decisions or choosing from among a range of possible actions or options, thinking in a very intentional way about what values are at stake and how the choice that you make might impact upon things that are valuable and worth pursuing or that might end up being harmful or detrimental. And I think it also crucially involves thinking about the interests and perspectives of the different people who are likely to be affected by your decisions or the different people that you're standing in a variety of relationships with in the situation. So one reflection that certainly has been front and center for me thinking about the whole issue of reopening, and unfortunately it's one that we as individual instructors are not in a position to do much about, is how at bottom, we collectively at UNC are not just here to dispense instruction. We're here to provide our students with an education. And an education is not just a matter of receiving instruction that's been dispensed, it's also a matter of students having an adequate opportunity to make the most of that instruction and capitalize on that instruction to actually learn and get educated. I think that when we're all together on campus and everything is functioning normally, there's a tendency to forget about that second element of every student having an adequate opportunity to take advantage of the education that they're being offered. Because when we're all together on campus, the public goods that support that element are all right at hand and open to everyone. So we take for granted that everyone has access to libraries where they can check out books. We take for granted that everyone has spaces where they can go and study and learn that are quiet, that won't be subject to distraction. We take for granted that everyone has the ability to have a stable internet signal. All the things that campuses and universities provide that go beyond instruction in the narrow sense. One of the things that was heartbreaking for me about our hasty retreat to our caves in March was that all of a sudden we lost all assurance that our students had access to those public goods that allow them to make the most of the instruction that we're offering. So all of a sudden we were in a situation where our students were back at home. We don't know what the conditions are back in their homes. Some of our students may be their family situation, they may be homeless. They may have domestic abuse going on in their households. They may have food insecurity. They may have ill relatives from whom they can't isolate themselves. There are many situations that could have been going on back at home that would impede students' ability to make the most of their education in the way that they, of course, can when we're all together on campus. They may not have had a quiet room to study. They may not have had an internet connection. Now, sadly, as I mentioned, these are things that as individual instructors, we actually can't fix. And so I raise this as an example of something we should be mindful of, even though there's not any straightforward way in which I can repair, say the home environments of students who may have to pursue their education at home. What we can do as we reflect ethically on our responsibilities to our students is realize that those responsibilities don't just extend to dispensing instruction. They do extend to this broader value of providing an education, and that means being mindful of the disparities and inequities in how our students may be able to take advantage of our instruction. So just a simple thing that you might think of is, suppose you were planning on assigning a research paper in your course. There are many disciplines in which that would be a very reasonable type of assignment to build in. You want to give some thought to whether it's a good idea to assign a research paper that would normally include actually being able to go to the library and check books out. Right? You may want to think again about whether that's going to lead to an equitable distribution of people being able to do their best on that kind of assignment. And you may want to think of a workaround, like you still assign the research paper because of the pedagogical and educational goals that will advance, but you ask students to focus on issues that come up in literature that's available in journals that can be, downloaded. Just things like that, realizing that a lot of the stuff that we've always taken for granted in our broader responsibility to provide an education may not be available to at least some of our students. The other issue I want to particularly highlight is I do think that when we're thinking ethically about our decisions, those reflections do need to be informed by the particular relationships that we stand in to different categories of people in our community. So as will have been clear from what I've already said, I think that we bear, in a way, an asymmetric relation to our students, in the sense that we as educators have responsibilities to them. And there's a sense in which they don't have responsibilities to us. Yes, they have responsibilities, not to plagiarize, for instance, but those are not exactly responsibilities to us. I think when it comes to the educator-student relationship, the responsibilities flow essentially one way, and our ethical reflection, I think, needs to always be mindful of that. The case that I want to flag is another example where we want to be careful to disaggregate the different values that are at stake, the different kind of relationships that are in play, and the way in which we need to take into account other people's interests is the special case of graduate students. So graduate students, of course, are a key important part of our community. And one of the things that again, under normal circumstances, it's easy for us as faculty not to disaggregate, is that graduate students play a variety of roles that give rise to different asymmetrical ethical relations among the parties. So on the one hand, graduate students are our students. We're here to help them get an education. We're here to mentor them, supervise them. There's a dimension of being a graduate student that is similar in its general character to being an undergraduate. Namely, these people are here to be educated by us. However, in practice, this gets very entangled with the other roles that graduate students play on our campus, because of course, the graduate student who on every second Wednesday, we're supervising their dissertation, for instance, it may be that every Friday, that same graduate student is leading discussion sections and recitations and being a member of the instructional staff for our courses. And we are used to relating to them under that heading, say on Fridays. And then if we're in the sciences, they may be in our labs, they may be pursuing scientific enterprises that are, on the one hand, both their own research, but they're also aiding us in the goals and aspirations of the lab. So I just want to mention to people that one and the same person may stand in a big variety of relations to us that we would be well advised to be mindful of. And to realize that what we can ask or expect of graduate students in different contexts may, very appropriately and legitimately vary according to the role that they're playing in that context and the role that they're playing vis-a-vis us. So I just wanted to mention those couple of examples as sort of ways of trying to think in a distinctively ethical way about the many decisions and actions that are going to face each one of us, even on a micro scale. Our actions are going to have a lot of unexpected consequences that we're not used to thinking about in normal circumstances. And so, if anything, reasoning ethically about the challenges that face us means expanding what we're thinking about. It means pausing to think about what additional factors I need to be mindful of and need to factor into my decision beyond maybe the ones that are front and center, like health and like literally how am I going to dispense my instruction. Thanks.
Thank you so much. That's really useful, really thoughtful set of principles and ideas. I have a million questions I'd love to ask each of you, but let me start with a couple of questions for Dr. Weber because he may need to leave early. The first one that comes from Sean Ahmed is, with this virus, about 40% may be asymptomatic or are now known to transmit the disease to others. If UNC has a lot of testing capacity, why not test returning students at the beginning of the semester and perhaps in the middle, treating a positive test result as a symptom? My concern is that young college students are less likely to show symptoms, so maybe many sick college students will be asymptomatic.
Well, that is an excellent question. The studies suggest that somewhere between 20 to 80% of people are asymptomatic. Those studies depend on how they're designed, and that's why there is such a wide range. How infectious they are has yet to be determined. Since they don't cough or sneeze, by definition, they're asymptomatic. Other studies would suggest that they will be less infectious, but we don't know what degree they're infectious there. The question you say, of course, I should say, first I want to say about a test. If we could test asymptomatic people today, but that doesn't mean they're not infectious tomorrow. The test only tells you at that exact time they're non-infectious. The incubation period is 14 days, and so that doesn't mean that they weren't in the incubating period and tomorrow would be infectious. So we never want a test result in somebody who's negative to be interpreted as that person is not infectious, and that's what we follow here in the hospital. Certainly, our capacity is revving up. Given the 20,000 students or so we have, we are nowhere near the ability, obviously, to provide routine testing for every student at some periodicity of every several weeks. We will clearly prioritize any symptomatic faculty, staff member, or student, people who, for whatever reason, cannot wear masks, potentially, such as sports team members there. And we will do very close contact tracing. If there's a case in a classroom or a dorm, we will go ahead and trace those people, and in that case, may provide, per CDC recommendations, testing of asymptomatic individuals. But unfortunately, while we have large testing capability, and more importantly, because it gives you false assurances by testing asymptomatic people that they're not infectious, we're not going to pursue, at least at this present time, to my knowledge, pursue widespread testing of asymptomatic individuals.
Thank you. I'd like to open it. Erin, would you like to throw in any questions here at this point?
At this point, I think we should open it up to our faculty, and I was wondering if you wanted to do this through the chat mechanism or another way, Andy.
Sure. What we typically do for the Zoom talks is if you'd like to ask a question orally, simply use the raise hand feature. And we're happy to call on you. If you'd like us to read a question, please feel free to post it in the chat, and we'll move from there. A question that's arisen that I think maybe all three of you could address in one way or another is the sort of behavioral question about college students back on campus, and that outside the classroom, in parties and bars and dorms and fraternities, we can't expect them to behave adequately in terms of distancing and mask wearing. Thoughts from any of you about what our expectations might be, and how that might play out in terms of either the infectious outcome for faculty, for staff members, as well as any thoughts about how to address or change that question?
Well, let me start off by saying I worry about this greatly. We've seen, as I've mentioned, increasing cases nationwide, statewide, locally, that reflect younger people, presumably not physically distancing and not wearing masks. And why do I say presumably? We in the hospital have, for the last 3.5 months, been taking care of somewhere between 20 and 40 known positive COVID patients, and we have not had any transmission to any of our many, many healthcare providers there, which proves to us that the mechanisms I just explained to you really do protect people, even from known high-risk interactions multiple times a day. So that worries me greatly. And and I've already mentioned that we've had exposures to some of our faculty from their children, and we can, to some extent, enforce masks and physical distancing on the campus. But if our students, and for that matter, our faculty or their spouses' children, go to community settings and somehow think because people are happy and smiling, they can't be infected, and therefore they can't get infected, then we are going to continue seeing community transmission, and that clearly will involve the university. I'm going to leave it to my colleagues about how we can better educate our younger students as well as our faculty about these risks, and how we can convince them of the importance, not only to themselves, but as a public health benefit, to wear masks at all times when in the public.
Andy, I have a little something to say about that, which is that, and maybe I'm influenced here by the fact that I'm the mom of a college-aged student who is now in a sort of very delicate situation of trying to decide if she wants to continue in the fall under these bizarre conditions, or whether she'd rather, take time off and come back when it's normal. One of the things that talking with her has made clear to me is that, and this won't be a surprise to anyone, college students see a tremendous amount of value in social interaction with their peers on campus. And I think that an important element in trying to persuade students to observe things like masks and social distancing, I think, would be to acknowledge that there is genuine value in social interaction, and indeed that there's genuine value in social interaction that involves, hugging and so on, and that we're very cognizant that everybody is being asked to actually make a sacrifice that is deleterious to something of value. I think it's easy to fall into a censorious mode when we read about frat parties and people packing, hundreds or 1,000 people into a bar. We think that's very careless, that's very needless. And just in terms of our messaging, my suspicion is that the messaging will be more convincing if, rather than taking a censorious tone, we link what we're saying to the values at stake, including the values that we are requesting that people, to some degree, sacrifice.
Dr. Sathy.
Dr. Sathy, oh, sorry, I was going to say the same thing, Andy, sorry.
Yeah, I think, David brought up a great point, and I see this a lot in discussions that it's born out of this sort of almost adversarial relationship we sometimes have with students, and we want to blame or acknowledge that they might be part of the problem. But in fact, as we see, like, I have children who are probably going to go back to school too, and so it's not this perfect vacuum where it's only the members of the community in our campus. It's actually a larger group of people, and we know how this, at least so far, what we know is that it can take minimal contact sometimes across people that we may not even interact with regularly. So it isn't an ideal situation in terms of isolating in the way that we might want to isolate. So it's not just our students who might be putting ourselves at risk. It's the entire community. But I think this is where we stand. I at least feel, having been a part of the Carolina community for over 25 years, I was an undergraduate here as well as a graduate student. I think our students are very well equipped to think about the greater good and the community aspect of wearing a mask. And that's how we might appeal to them, that this isn't just about personal safety, but also just what we owe each other as a community to be doing this work. So I think we have ways in which we can message, and we're learning. I think social psychologists and as well as other sociologists are thinking about ways to frame better behaviors. But I think it's important to acknowledge that it's not just about the students, that it's all of us who are part of the community who owe it to each other to practice these behaviors. And that hopefully we have what it takes in terms of the mindset to be able to do this well. But I think what Sarah is saying too is really important, acknowledging that this is a hardship for every single person in our community. And this is similar to when I encourage students to avoid distractions in classrooms, right? I acknowledge that that's difficult for me too. It's not just because they're 20-something-year-olds for the most part. Obviously that ignores lots of other non-traditionally aged students, but just because it's a human condition. And so we really need to be thinking about putting ourselves in that equation as well.
Wonderful, thank you. We have several hands raised, so I'm going to begin. I think Sherry Salyer may have been first. Sherry, would you like to jump in?
This is more of a comment and a reminder, especially to what Sarah and Viji mentioned. I live only 10 miles south of Chapel Hill and have terrible internet connectivity. I managed to survive the end of the spring term and started second session on Monday. It just was worse. And AT&T came out, no problem, other than it's just very slow. So today I went to campus to teach and borrowed a webcam from my department chair, got that fixed up. And so I am back on campus, and here I am. I live close to some place you would think of all the places in the world would have great internet access. And it's not, and being a professor, we all think we should have great internet access, but it didn't. And so if it happened to me, what's it going to be for a student in rural Bertie County that they have just a few stoplights? So it's just a reminder, and that certainly reminded me again to be more patient and understanding myself.
Thank you. I'm going to move to the next hand raised belongs to Emily Bohm. I apologize if I mispronounced your name.
Thanks. It's Bain, but
Bain,
that's fine.
It
doesn't look like it. But thank you. My question is for Dr. Sathy. So I'm teaching this summer and trying my best to be inclusive, and I have it's an asynchronous class, but I have synchronous office hours. And I know that you have some creative, structured methods to encouraging students to come to office hours. And I wonder if you have specific tips for making those work in a remote setting and trying to forge that connection, because the opportunity is there, but how do we get students to take advantage?
That's a great question, Emily. For those of you who don't know, Emily is at the Center for Faculty Excellence, and I hope soon we'll be offering the same training that I was a part of last fall, which was the Equity in Teaching training. I think it was a valuable resource to think about the context of our university, the history of our university, and how we can be teaching inclusively. So I appreciate your work there. This question about office hours is a really good question. And I think it's again back to what's the benefit of office hours? Why are they being offered? I think, oftentimes as new instructors, we just look at a person's syllabus and we say, well, we have to have office hours, so I'll have office hours. But if you don't think about what the purpose is, then you don't actually embed the principles that actually allow those good things to happen in office hours. So we know that office hours are linked to student success. We know that they are ways in which we become, rather than instructor-student, we start to move to advisor or mentor. These are ways in which we build relationships with students and help them along their path, their educational path, right? So just hosting an office hours doesn't necessarily mean that students will come. And we know from Anthony Abraham Jack has a great book out, and he talks about his experience as a first-gen college student and saying, I didn't know what office hours were. I don't know what they mean. I don't know what they're supposed to be about. And that's fair. Office hours as a term means nothing really. And what you intend for them to be as an instructor is what your vision of it needs to be clear to students. So I would say the first step is to make it clear. What is the purpose of your office hours? And then the next step is to be designing experiences through those office hours that encourage that purpose to be met. So I started having conversations really early on with my students when sometimes they'd volunteer that was the first time that they'd met with an instructor outside of class. And sometimes they were juniors or seniors, and I was struck by that. And I asked, why did it take you so long to do this? And so they would offer up reasons, and that allowed me to formulate what I have now as a sort of a menu of options for meeting with students. One of those options are what I call 5-minute meetings. And so students sign up for a 5-minute slot. And the expectation is that we probably won't talk content at all. It's really just to get to know each other, introduce each other, learn where you're from, what kinds of things you enjoy. And I mean for it to be a conversation where they learn about me as well, not just a one-sided interrogation of their experiences at Carolina. And so those 5-minute conversations, they're brief, but they allow for us to have a personal connection. And sometimes it means that they learn where my office is, for example, or that I am approachable and that they can contact me. And it allows me to have that opportunity to say, great, now if you have questions about X, Y, or Z, or if you'd like to talk about career options, like this is a great time to come in and talk about it. And then moving into the semester, I shift away from these introductory office hours into more substantive meetings where students might have questions about content, but then I allow for them to sign up for those. I think that's important to consider, especially in the online environment. If you just have your Zoom room open and expect them to come, they're going to do the same things that you probably would have done on campus. Is you'd have your office doors open, but hardly anyone shows, because one, they're going to assume other students might be there, and so they won't know that you're in fact free. And then the other is they might not know what to talk to you about. They might have one small question and it seems not worth their while to pop in to ask that one small question, or they might not want to appear like they don't know the answer. So this is where it's really helpful to have these signups available, and our Sakai tool allows for you to have signups. So giving them transparency and who is meeting with you so that they can in fact see there is a slot available, and assuring that they will be able to chat with you during that time is really key. And then I move towards the end of the semester to what I call my co-working office hours. And so these are opportunities where students could interrupt. We would sit together in a room, but they could interrupt with questions about content, but we could also just sit quietly and work on things together. In the experience where we get to meet in a building, I would often bring snacks and we would just sit and study for finals and things like that. But in an online environment, it might just be bring your lunch or your pets, or just let's have some time where we might work together. As questions arise, you can ask them. So I think the key thing is to be thinking about the purpose of those meetings and designing experiences that allows that purpose to come through.
Great.
Thank you, Dr. Sathy. We are going to alternate too into some questions from the chat. And the first one that's in the chat that we have is from Hannah. And this probably is to Dr. Weber. Do you know if clear masks for individuals with hearing loss have been studied in terms of effectiveness and have been ordered by the university?
So the answer is I don't know published studies on that. I do know we are looking at here, our colleagues, Dr. William Bennett in the EPA research building, he's an aerosol engineer, are in fact looking at those at the present time. And they're also, although the methodology needs to be changed, going to be looking at just face shields without masks underneath, also something we don't have data on, and they're doing it at the present time, as well as looking at a variety of cloth masks and how long masks can be reused and whether they can be re-sterilized.
Thank you.
I think our next raised hand is Jonathan Engel.
Hi, I came in during the middle of the discussion about testing, so if I say something that's already been covered, just mute me or cut me off or whatever. But I do have a question about testing, and it has to do with the assertion that people get a false sense of security from a negative test. So I know that this is the reason that's been put forth for not doing more testing, and it's frustrated me and a lot of other people I know, because our students are intelligent. They can certainly be informed when the test result comes back that exactly what it means. It means, you know, there's some probability of false negatives. It means that even if they really are negative at that time, they could be positive later on. They can be told these things, and I don't understand why university wouldn't want as much data as possible. I mean, even if the test doesn't prove that the person is negative at that instant, it does provide some data, it gives you probabilities. And the idea that you wouldn't test because you know, you're afraid that students would misinterpret the tests, I don't understand. If the constraint really is the inability to test more, then that's something I think should be acknowledged. But what I would like to know is, why isn't the policy designed to get as much data as you possibly can for whatever amount of testing you can do?
Well, actually, this is David. I can answer that in part. The answer is the university is supporting, and they will be doing a large IRB-approved study that will include exactly what you're suggesting, both prevalence and incidence testing of thousands of faculty, staff, and students. It went to the IRB last night for approval. I don't know the results yet, but I think that study will be, I'm sure it'll be approved, will be up and running within the next 2 weeks to do exactly what you're saying with the informed consent and with provisions that people who develop symptoms would be tested using an FDA-approved test. That will be offered to students and faculty for participation. I should say Audrey Pettifor at the School of Public Health is the lead investigator on that study.
Great. Thank you, Dr. Weber. We do have another question from the chat from June Merlino. And her question is, do we have access to what student affairs are doing with students? Orientation messaging, videos, resources, inspiration, we are all in this together mindset, etc.
I think the implied answer may be no, we don't have access, the folks on this call, to what they're doing. And there are a few questions in that in the chat, Erin, that may be worth your and my investigating for the faculty support hub that we're both working on together. So we may want to note that one as one of the questions that we can work on for there. Any of the panelists want to address it? Mimi Chapman, incoming chair of the faculty as of tomorrow, writes that they're inviting some individuals to speak to that question to the next faculty executive committee meeting, which will be on July the 13th. Great. The next raised hand was from Joy Renner.
So Dr. Weber answered part of my question, had to do with, are we looking at face shields and how face shields can be worked? I also have a faculty member who has a severe hearing deficit. And so we're looking at wanting to know more about the clear masks for her to be able to communicate easier with the students, because she lip reads a great deal. But the other question I had, because I understand we're studying that, so that's helpful. The other question I have is, if a faculty member is at the front of a classroom and they're 10 or 15 feet from the closest student to them, do they have to have a mask on while they're teaching?
So let me add, so the answer is yes. I think that a clear face shield, or at least with a piece where over the mouth is clear, will work effectively, but no one's proved it. We're looking at that now. Face shields will be, it'll depend on how far the face shield wraps around, how it protects, what the airflow is. That's going to be more difficult to study and provide guidelines, but that's going to be, we are studying that, not me, Dr. Bennett is. Your other question is that it's currently university policy that everyone inside a classroom will wear a mask. But you're right, the longer the distance, the bigger the auditorium, the space, the lower the risks. And so that I'm sure we'll have some future discussion whether they can set parameters. If you're far enough away, you can take your mask off. But it's currently the university policy to be ultra safe is you would wear a mask. The others, I think, by the time school opens in roughly 5 weeks or so, 5 or 6 weeks, we'll have definitive data on.
Thank you. We do have a question in the chat that may be in the category of further investigation, and that is, if we do suspend, this is from Sean Ahmed, if we do suspend in-person classes, will students be given an option to remain on campus for reasons related to internet connectivity or domestic violence at home? So there may be some in the audience who may have an answer to that based on their experiences, but we can also pass that up if needed.
So I can't say anything about whether that will be allowed, but I think there's an ethical case for giving students that option.
Okay, our next raised hand is from Jennifer Morton.
Hi. I think this is related to the last question, and it was about why we hadn't considered in the kind of scenario of opening up, whether to just open up for students who were more vulnerable, who were in areas where they didn't have a lot of internet access, or maybe were first-year students where the kind of first-year college experience really matters. It seems like some campuses have gone down that road as a way of having less density on campus. And it seems that if we're thinking about the ethical trade-offs here, it would make sense to prioritize different populations of students differently, rather than say like we're all open or we're all closed. So I was just wondering about that.
Any thoughts, Sarah or Viji?
I mean, I guess the decision makers aren't on this call, Jen. So I don't think there's like a direct answer from the point of view of the decision makers, but I hear you that, you know, the ethical imperative to give people access to those public goods that I mentioned may be more urgent with some populations than with others. I guess the judgment was that some of the sort of intangible aspects of educating our students are sufficiently valuable that we want to extend them widely.
Yeah, just to be clear, we did, it's not that we weren't going to welcome them, but we did not want to invite folks to the call to make this a policy conversation. Our goal was to explore the issues. So Erin and I will certainly take the questions that go to policy, and we'll try to do what we can to get good answers to them. But our goal here is a conversation about the thoughts and ideas and principles behind it.
And I would add that, you know, I know that from the from the spring semester, at least, there were students who could petition to stay on campus for a variety of reasons. So I would imagine those kinds of mechanisms would also be available, but I don't know the answer from the policy standpoint, but I know that at least from the perspective of supporting students, that has been done in the past. And so I would hope that it would continue to be done. I think it's also important to be thinking about those equity issues that you've mentioned throughout our plans for teaching. And you know, the idea that we might not have reliable internet access as instructors or students means that we should be thinking about really simple ways we can communicate with one another. I'll give you an example. In my spring semester, I had a student who had that same issue where they just couldn't get an internet access strong enough to upload a file, for example, a homework assignment file. So I said, no problem, just send me some pictures, take some pictures on your phone, text them to me, and I will upload it directly myself. So it was in the system so we could grade it in the same ways, but just to be thinking about, you know, what are the requirements of your students, and how can we be more flexible in how we take information from our students? And sometimes it was just a simple like, hey, do you want to get on the phone for a second and just work this out? Like, we forget, we've got Zoom, but we forget that we could just pick up our phone and just talk to one another and sort it out very quickly. So just to make sure that you've got those. And I know sometimes instructors are a little bit squeamish about giving out their mobile phone number. So you can sign up for like the Google Voice number. That's the number that I actually post in my syllabus so that students don't have my cell phone number, but they have a way of contacting me. But there are these ways that we can just quickly connect and get information. We just have to think creatively about it and be open to the fact that it might not happen the way that we intend, but also to explain to our students that if you experience a hiccup, I want to work with you to come up with a solution. So let me know early, as soon as you know it, so that we can figure it out together.
Thank you, Dr. Sathy. I wanted to share to the conversation a comment in the chat from Mimi Chapman. We are inviting some individuals to speak to that, meaning the issue that we brought up about students who may not be able to function off campus, to the next FEC committee, the Faculty Executive Committee meeting on July 13th. There is the Carolina Away option, and I think they are getting data now on what students are choosing. We will hear more about this at the FEC as well.
Great.
And then Sherry Sawyer pointed us to the roadmap again. Thank you.
And the next raised hand is from L.M. Ball.
Hi, I have a question that really has to do with more with education of the community in the general sense. Can you hear me?
Yes.
Okay. And that has to do with how can I talk to the people who take wearing of masks as being a political issue or an assault on their personal freedom, rather than simply an issue of controlling infection. This is something that I wrestled with a lot, because I do occasionally have to talk to such people, even within the university community, of course, mainly outside the university. And I mean, this is something that I, as a scientist, and I'm in School of Public Health, as a scientist, this is something that I really wrestle with, because I just don't know how I can find convincing arguments. I mean, when I'm dealing with my own students who have taken biology courses and chemistry courses and environmental health courses, I think I can come up with convincing arguments, but I just feel that I'm running into a brick wall when I try to talk to people who simply take wearing a mask as being an assault on their personal freedom. Has anybody else given any thought to that? Is this something that's at all important within the university community? Crickets?
Again, I think that might be helpful is just acknowledging that it is a limitation on our personal freedom, and we would all prefer not to have masks over our mouths. You know, my daughter says her acne's acting up, you know, under the mask. So it's not that such people are incorrect to point to there being a downside to wearing a mask. I think one thing that has gotten a bit confused in the public discourse about this is that if people think it's primarily for their own protection, then they may think, well, I just choose not to protect myself in that way, and that's my choice. So I wish that it had been very, very clear in the public discourse from the very beginning that it's primarily to protect other people that we should wear masks. That makes it a little harder to dismiss. I don't know whether that is going to be enough to change the minds of people that see it in those Manichaean terms, but it is a little more difficult to, you know, just dismiss doing something that is for the sake of other people in the community, as opposed to just choosing not to take a certain level of protection for yourself.
But the answer to that is, if people feel they need to protect themselves, they should be responsible for their own measures. For the people who have risk factors, for the aged, for the people who have medical disabilities, it's their own responsibility to stay out of the line of fire. That's the answer that I have sometimes got.
I would say that, I mean, it's a lot of the same discussions we have around vaccinations. I think, you know, just the idea that that we're providing immunity to people who can't have the vaccination. It's interesting, Sarah, you said that you thought we made the mistake by saying this, and I actually feel a little bit differently. You know, living in America, this sort of individualistic society, I think people might be more swayed by that this is protecting them, but maybe not. Maybe there's data that says, you know, that a combination of the two, and depending on who you are and what your how you perceive yourself in the community might matter a little bit more in terms of messaging. But I would say what absolutely helps is building structure that actually enforces the policies, right? So having requirement that in a classroom, the instructor and students are wearing a mask, or in a building, the instructor and students are wearing masks. These are ways in which we mitigate against those conversations, because it's just a rule and you're not allowed to break the rule. So that's one way in which we don't even need to have the discussion if we have structures in place that allow for that to not be a discussion point.
I feel fairly confident that I can exert enough moral authority over my own students to convince them of that. But how about the rest of the world, or the rest of the country, which is where much of the infection is coming from?
I'm going to jump in as someone who studies political discourse instead of as the moderator for a moment. I'm actually part of a research group with some folks from political science here and at NC State, working on what messages around masking resonate well and are convincing, particularly to people who are not well disposed to masks to begin with. And one of them, interestingly enough, is that they seem, well, this is very preliminary data, I should give you that caveat, but one of them is that they seem to actually prefer surgical masks over cloth masks, because they feel the surgical mask is more of a medical thing than a sort of fashion statement. And so to some extent, the sort of semiotics of the mask are quite interesting in those settings. The other thing is that, while I agree with Viji that there's this incredibly strong individualistic strain in American political discourse, there's also a communitarian strain, which has its own dangers, but that the argument that not that you're just taking care of others, but you're taking care of your family, you're taking care of your community, you're taking care of your coworkers, actually appears to be fairly strong. And so I think there are some sort of discursive elements that we can try and build on, that takes seriously, as Sarah pointed out, that it is in fact a sacrifice, but it's a sacrifice for the good of a community that people may care about. Let's see. I think
Sherry Sawyer had her hand up physically.
Just a note on this whole idea of mask wearing and what right do we have as professors to make people wear them. I can't control anybody. I can't control anybody actually, but I can control anybody outside my classroom. Internally, I think is where we're going to have some more control. I personally think it's not going to be an issue in class. Now I think they're going to party and it's going to be an issue and they may take them off around campus, but I think our students are going to be really vigilant about it. But I think the provost is going to have some advice and words for faculty on what to say if you walk into a face-to-face classroom and a student says, I'm not putting on this mask. And it's going to be fairly strong, as in, okay, I'm not going to teach this class face-to-face then. And I would watch the roadmap for that. It is a concern. I know the provost is very, in his group he's working with, is very aware of this concern from faculty. What policing do we have to do in regard to this? So I think it's going to be helped later as we get closer to the start of classes.
I'll read a comment on this also from the chat. I'm not sure who the person is, but the person says, I'd like to suggest that we put this in the context of foodborne illness and hand washing and cooking food. Masks being just the same thing as hand washing for respiratory disease. I have a question I'd love to raise with a couple of, with all our speakers again. The thing that many of my colleagues seem very certain, I feel very uncertain. And I feel like the experience of this whole pandemic has been one of dramatic uncertainty and sort of very partial knowledge. And I'm interested in both, Viji, I know you teach statistics, which one of my former graduate school colleagues had a slogan, which was statistics means never having to say you're certain. And Sarah, also I'm interested in if we can think through some principles for ethical decision making under that great degree of uncertainty. When we don't know what our students are going through when they're not here on campus. We don't know what the virus will do, or we're learning every day more about how the virus behaves. And so I'm interested in how we engage well under context of that great uncertainty.
Yeah, well, certainly uncertainty, one thing is certain, uncertainty makes everything more complicated and more difficult. When there are so many things we don't know about what the impacts of our choices may be, that of course makes everything more difficult, because even if we had perfect certainty what the impacts would be, we would still need to exercise ethical reflection over choosing which set of impacts are the optimal ones that we want to actually bring about. So it is very difficult when we don't even know what the impacts will be. One principle that may be appropriate in cases where there is a sort of radical uncertainty is to be attentive to what are some of the worst case scenarios and who might those fall on. So one important component in ethical decision making is thinking about if there are people in this scenario who are going to have to assume heightened risks or who may be at risk of adverse outcomes, who should be the people that bear those? And a principle that's often appealed to in ethics is that you don't want the people who bear the heightened risks of adverse outcomes to be the community members in your scenario who are already the most disadvantaged and have the least room for maneuver to handle any adverse outcomes. So that's not itself an answer, but it's a principle that's worth thinking about. If by, say, taking on more risks myself, realizing that, you know, at a minimum, as a tenured faculty member, I'm not at risk of, say, losing my job. You know, there's some things I know I'm not at risk of. If, say, by taking on more risk myself, I could preclude or lower the chance of something that would be really catastrophic for somebody else who is approaching this scenario from a less advantaged position than I am, then ethically we ought to seriously consider that. I mean, that's just a schema. I can't point to a concrete situation where that kind of reasoning would really apply, but that might be one way to approach, is to think about what would be the worst outcome and on whom would that fall. What can the rest of us do to try to keep that from happening without numbers attached, because we don't even know what the numbers are.
Thank you.
Thank you, Sarah. Viji, were you going to say something?
I was just going to say, I love the way that you frame that, Sarah. And it's oftentimes how we talk about inclusive teaching is, you know, what is any decision I'm making, by making that decision, who's being left behind? And really thinking about not disadvantaging those who are already at that space where it's, you know, it's disadvantage upon disadvantage, right? So I love thinking about that. The only thing I would say is that sometimes we're not the best equipped to see those spaces. The lens that we bring to a situation is our own lens. And I think this is where it's helpful to rely on multiple people to inspect and give feedback and to really be open and honestly open with the fact that you're going to make mistakes and that this is part of a process and that you want to work with, in the case of students, you want to work with students to help you identify areas that you can shore up. And then I think we have, for the first time in probably a long time, we have permission now to work with our students. I mean, I would have liked to have said we could have done this before COVID, but I think it's fair now to say to students, we're all in this uncertain situation together, and I'm probably going to mess up a few times, if not many times. I'm going to need you to help me point out where we can do better and what kinds of things will help you accomplish the learning goals. So I think looking at multiple people to help you with that is really important as we move forward. But I'd also say, I mean, it's funny that you asked this question, Andy, because I think of all people, academics should be most prepared to think about what uncertainty, how we move forward in the face of uncertainty. Because we didn't push on some area of knowledge that didn't exist without getting to this space. And so we have the skills, I think, to really grapple with this in some ways that maybe colleagues in other disciplines or areas might not have. But I think it's, again, an opportunity to model what we do and how we respond to all members of our community, not just our students, about what it looks like to be in the face of uncertainty and how we can move forward inclusively.
Great points from both of you. Thank you.
Thank you.
Erin,
There is a comment from Phil Edwards from the CFE saying, I am heartened by the administration's current disinclination into involving campus police in the enforcement of mask wearing on campus. And it looks like Lloyd Kramer has a question.
Thank you, Erin and Andy. I think uncertainty is part of the human condition. So the Institute for the Arts and Humanities is one place for coping with that part of the human condition, which never goes away. It's just that sometimes we're more aware of it or less aware of it. But I actually had a question for Sarah, because this is a discussion I've had with a number of faculty about our ethical responsibility to others. Many of my colleagues have said we really should just go entirely to online teaching. This goes beyond the question of the interest of students. But if we went entirely to online teaching, then all of the people at the university who work in student support services, who work in the residence halls, the people who manage the buildings would most likely be unemployed and would face dire economic consequences. So we would be protecting our own health, perhaps, as faculty members. But what are the ethical responsibilities, as you would see them, for people who are not either students or faculty, but whose lives are also deeply dependent on the financial well-being of the university? I mean, I don't think there's an easy answer as to what we do, but this has been my great ambivalence about when people say, well, we should just do everything online.
Yeah, that is a great question. And actually that dovetails really nicely with what I was just saying about trying to avoid the worst case scenarios falling on the shoulders of people who are the least advantaged in our community. Maybe this is an example of that, that by keeping ourselves as instructors safer, by remaining at home and teaching exclusively online, if the outcome of that would be massive job loss on the part of our cafeteria workers, our groundskeepers, our student support people, that could be viewed as an example of exactly the type of thing that the principle that I just enunciated would recommend against. Those are catastrophic losses for the staff. They are arguably less well positioned and advantaged than we are in a number of respects. I agree with you that the situation is difficult in that with respect to the educator-student relationship, I think it is relatively uncontroversial that we have these responsibilities that flow in one direction. That is that we collectively as a university have responsibilities to provide an education to our students. It's less clear that we as faculty have responsibilities to staff. They're valued members of our university community. So to the extent that we care about our entire community, their weal and woe is of course relevant. I don't think there's the same kind of obvious one-way responsibility of one party to another when it comes to faculty vis-a-vis staff. But if there's both an educational value at stake in not going completely online, which I've tried to suggest there is, insofar as if we go completely online, we're taking our students away from the public goods that are provided on campus that they may need in order to make the most of our instruction. If there's a purely educational case for not going online, and also the consideration about the potentially horrible impacts on staff, maybe when you put those two things together, you get a compelling moral argument. So I don't have an answer, but I think that's a very good thing and very relevant thing to bring up. Would we as faculty like to see a scenario where we keep ourselves safer at a cost both to our students and to non-academic staff in our community? I think it's hard to answer yes to that.
Thank you. I think you've raised the key issues.
Jennifer Morton has another question.
I just wanted to follow up on this point, Sarah. I'm just wondering, at what point do we ask the question for staff, and those considerations that stem from, as you said, parts of the campus that are not kind of directly involved in the pedagogical relationship between teacher and students. And we ask, well, isn't the responsibility for what happens to staff and their families in part one that falls on the federal government or on the state government? You know, we have to think about unemployment insurance and other aspects of the safety net. And I think that's what can be frustrating when the kind of the, I'm not sure if the word to put is the blame, but the responsibility is put on the shoulders of individuals to bear the cost for failures of like institutions like the federal government not kind of doing what they should do. And, you know, you look across to Europe and you see massive unemployment efforts to keep people in their jobs. And you think, well, do I have to risk my life so that, you know, people who are working in the university community have a livelihood? The answer clearly is no. There are alternatives. It's just they're not under our control.
Yeah, that is a great point. If we knew that government was going to step in with a wage replacement program for anyone whose services aren't required over a period of months or a year or more, that would be a very different and in some ways much preferable situation.
I mean, of course I agree as well, and I'm going to again shift hats here, but I would like to point out that we do much more on campus than teaching and learning, and that the classroom is only one of many interactive environments about the production, communication, and deployment of knowledge. And Sarah's early comments about graduate students were, I think, one piece of that conversation. But honestly, I think that if we as a society are going to survive 2020 and flourish after it, the one institution that is going to be necessary to make that happen is the American university. And so my concern is that we not think of this so narrowly as just what goes on in the undergraduate classroom, but also that the sort of rich, synergistic intellectual environment for the production of knowledge, for communication between humanistic questions and scientific development and behavioral questions and statistical questions can really, it's limping along through electronic means right now, but it's not flourishing. And so my concern is that we not narrow the lens so much that we ask about only this one element of the critical role of the university, and think about all the things that we need to be able to contribute to society and are not able to do so at the fullest level because we're closed. I want to emphasize this is not an absolute argument for reopening, and it's sort of, to put it in the terms Sarah has already suggested, it's a piece of an understanding of a trade-off that I'd like us to think through.
Yeah, and just to clarify, I was just pushing to think even broader than that, right? So much of what we can do is due to these political structures that in some cases are failing us. So, you know, we look at countries that have gotten the outbreaks under control and are going back to school and are doing research and are collaborating. And so it's not just what we're doing within this institution. What we're doing and how much we can actually do depends so much on what the government does for us and what decisions they're making that make it possible for us to undertake much of the work of the university safely.
Mm-hmm. I did want to point out in the chat, Jonathan Engel's comment that's more university based. Aren't there ways of redistributing university funds or salaries to protect people who wouldn't be working if we go with completely online classes? Is the best solution really to put everyone at risk?
the answer to that, I think, would need to be sensitive to what Andy just raised. That, I mean, I'm sure if we had decision makers on the call, they would say there isn't any realistic redistribution of university resources that, you know, could cover, you know, all the people whose services wouldn't be needed. But there is also what I think Andy was rightly alluding to about the value of what takes place at a university, again, beyond just dispensing instruction.
Thank you.
And I think to Jennifer's point, also, again, thinking as a sort of democratic theorist and researcher, it's really tough not to see the situation we find ourselves in as a catastrophic breakdown, both of government function and of the public sphere. And so in terms of sort of assigning responsibility, I think that is quite clear. I don't know that that gives us a great lesson for how we ought to distribute the costs or the risks of that fact, you know, now that we are where we are. Are there other folks who'd like to make comments, ask questions? Would any of the panelists like to offer concluding thoughts? Erin, shall we wrap it up?
I think so, Andy. Thank you.
Thank you all. I'd like to thank our three panelists for a really fantastic conversation this afternoon. It really gives me great faith in the knowledge that we are able to produce and discover together in this context. And Erin and I will work on getting some of these more specific questions addressed. You'll find the video of this event on our website as soon as we can get it edited and cleaned up and ready to post, and we'll publicize that as well. In the meantime, though, let me just say thank you again to the panelists. Thank you to Erin and the staff at the Center for Faculty Excellence, as well as to the staff here at the Institute for the Arts and Humanities. I wish you all a safe and healthy afternoon.
And I just wanted to add some thank you to all of our participants today, not only on the panel, but also in the audience. I thought that the discussion was rich all the way around and gave Dr. Stroud, Sathy, and Weber a lot to respond to. And I think the conversation was very effective. So thanks to everyone. And thanks again, Andy, for inviting us to help co-host this.
Wonderful. Thanks again. And
great to talk with everyone. Thank you all.
Thank you.
Thanks, everyone.